Have you just hurt your back? Maybe you were lifting the groceries out of the car, or your kid ran up and you picked them up, or even maybe you're making the bed and you reached over to grab that pillow and you felt your back go. Well, my name's Emma and I'm a physio and an EP, and hopefully today in this video we can give you some information that might help you put your mind at ease. So in my work as an EP and a physio, it's probably the most common sort of pathology or injury that I see in day-to-day work. People will come into my clinic exactly as I've described. They've just bent over or twisted a little bit awkwardly, and all of a sudden heaps and heaps and heaps of pain, and they can barely move. The really, really good thing is that in 90 to 95% of cases, it's absolutely nothing to worry about. We can scan it, we can x-ray it, but nothing comes back that's of any concern. In my experience, lower back injuries like this are about as serious as ankle sprains. So I think, ask anybody, we've all done an ankle sprain, nobody worries about it, do a bit of rehab and off you go back into sport or whatever you were doing. This is pretty much exactly the same. Most of the time what you've done is just overstretched or overloaded that muscle in your back a little bit, and your body will respond, send those muscles up into a lot of spasm. And look, I've done it myself. It's excruciating, it's so painful, you can barely move, and your immediate thought is, oh my gosh, I've done something really, really, really serious. But as I was saying, most of the time, absolutely nothing to worry about. So what we need to do is keep you moving. So one of the big misconceptions, and we're starting to get away from it now, which is fantastic, is that you need to go to bed and just completely rest, not move at all. But in fact, that's actually probably the worst thing you can do. That will just keep the spasm, that'll just keep it stiff, keep you really, really sore. What we need to do is get the body moving. I'm not saying, jump in the gym and lift 100 kilos or go for a run. It might be just walking up and down the corridor or going for a walk around the block. It's getting that extra blood flow, warming those muscles up, and teaching your body and your brain that these movements are healthy, and that will start to get the spasm to settle and get you moving again. Then the next kind of steps are to build that strength back up. Usually that spasm will have happened from a little bit of progressive overload. So we've done a little bit too much of that muscle over time, whether that's, you've got new kids or a new puppy, or you've started a new job and you might be doing a little bit more lifting than you used to. So usually setting up a bit of a program that builds that strength for you, or get you in the gym and get you moving, is usually one of the best things to build you back up and ideally stop that from happening again. So if that's of interest for you, or you'd like some more information, give us a call or jump online and book an appointment to come in and see myself or one of the other physios or EPs that work here. Thank you for your time.